In the next several days, we're going to be focusing on an incredibly important topic as illegal drug overdose deaths are on the rise at a level officials say that they haven't seen in the past. I've done a number of interviews in the last couple of weeks with law enforcement, addiction experts, and those who we have talked to before, those who are in addiction recovery. We're starting this series, though, with the agent in charge of Minnesota's Drug Enforcement Administration. Fentanyl overdoses have been happening at a rate of 43,000 deaths over the last year. From New Mexico to Seattle, Connecticut to Florida, the National Center for Drug Abuse says fentanyl is a factor in 53% of all overdose deaths in this country. Not only is that a frightening reality, some of these deaths are either first-time users, people who for the first time ever used an illegal drug, and people who have been in recovery who have had a slip that ended up costing their lives. Angela von Trytek is an assistant special agent in charge at the Minnesota Drug Enforcement Administration. And Angela, I wanted to talk about not only how big of a problem fentanyl-laced street drugs are, but also it's something that continues to grow. Your agency is seeing what? How do you battle something that seems so out of control?
Well, it's very difficult, but we do our very best. We work hand in hand with our local and state counterparts, as well as our partner federal agencies, really to try to stem the proliferation of drugs into the state of Minnesota.
How bad is it? I want parents to really hear what kind of problem we have. Other communities, they've got officials warning, urging parents to get involved.
Sure. Well, last year, I got here in July. I became the assistant special agent in charge of the Minneapolis office in July of 2020. And for the year of 2020, this office seized 46,000 fentanyl-laced counterfeit pills. This year in 2021, we are already on par with that 46,000. So I believe by the time the end of the year, we will probably have doubled that amount. Now, certainly some of last year's 46,000 count could be contributed to issues with the pandemic because there just weren't a lot of places down. There wasn't a lot of travel. The borders were closed. But now that people are being vaccinated and other countermeasures are in place for the pandemic, you're really starting to see the flow of illicit pills coming back into the state.
Angela, when I talked to a former addict, he had told me just recently that he was forced to lace whatever he was selling with fentanyl, forced by the people that he got his supply from. So where is this fentanyl coming from? How are they getting their hands on it? And who's doing the lacing?
Most of the fentanyl that we're seeing here in the Minnesota area comes directly from Mexico. It is being produced in clandestine laboratories in the country. The chemicals are being mixed down there. They have large-scale tableting machines, which they're churning these pills out. You hear them referred to as M30s, as oxys. They're referred to many street names, but they're still the same general size and consistency of what you would see a legitimate pharmaceutical oxycodone prescription with. And they're being produced in Mexico, and they're being shipped across the U.S.-Mexico border. And generally, once they make it into the United States, we're seeing people either mail them via the Postal Service, FedEx, UPS, or they just drive it up and try to secrete it in different carloads, tractor trailers. It's really amazing at the different ingenuity and different smuggling methods that people will use to get pills into the state.
And just when you think you've got them figured out, they come up with new ways, I have to imagine. One of the guys who we interviewed...
It absolutely is.
Yeah, one of the guys we interviewed back in December was sober. He was talking about and encouraging other people. This is why I got sober. This is how you can, beat your own addiction and that kind of thing. And the hard part is that he fell off the wagon, which happens, but not only that, he got a bad batch, and fentanyl killed him 2 weeks ago. It was the first time he had fallen off the wagon. I want people to really understand that these drugs that their kids are getting or that they're getting a hold of they could kill you one time.
And that's correct. I mean, it really only takes 2 milligrams of fentanyl to be a lethal dose. And a lot of that depends on a person's weight, age, addiction level, how long they've been taking a medication. But people must understand that fentanyl is 50 times more potent than any type of opioid medication. So with that being said, because these pills are being mass produced, they have no quality control. So you may get one pill that has less than 2 milligrams of fentanyl in it, or you may get a pill that has 400 milligrams of fentanyl in it. That's the danger. You just don't know what you're getting. And DEA takes this problem along with our state and locals very seriously, trying to stem this because people really don't understand. And DEA is all about lives saved as a result of the pandemic, as well as the problem of opioid abuse in this country and in the state of Minnesota.
People are saying if we legalize recreational use marijuana, that'll cut down on this because then it won't be coming from the drug cartels. Do you see it that way?
I do not see it that way. I firmly believe that any type of substance that you introduce into your body, whether it's marijuana, alcohol, pills, none of this is good for you, really. I mean, everything should be done either under the guise of a physician because you do have a legitimate medical malady, or that you should just enjoy what life has to offer and not ingest any chemicals, whether that's alcohol or marijuana. I think both drugs can be hugely addictive.
Yeah, and that's what we're trying to focus on and hopefully give hope to people who do have a problem with that. Angela, I really appreciate your time, your insight on this, and hopefully the next time I talk to you, it'll be because things have gotten better.